Cancer prevention and early diagnosis. It is well known that preventing a disease is far less complex than trying to cure it. This principle applies to any disease, including cancer. Scientists from the world's leading research centers are devoted to finding and defining all possible risk factors of developing cancer. By controlling the risk factors and minimizing their effect, we can significantly lower cancer incidence. The World Health Organization, WHO, defines risk factors as certain characteristics of individuals or the environment that increase the likelihood of one developing a disease. Among scientifically proven risk factors of cancer, the following ones are the most proven. Infectious diseases. A number of infectious diseases cause structural changes in body tissues, which results in developing malignancies. In this regard, the following infectious agents are crucial: hepatitis B virus, HBV, and hepatitis C virus, HCV, human immunodeficiency virus, HIV, human papillomavirus, HPV, Helicobacter pylori, and other bacteria. Treatment with modern antiviral, antibacterial, and antiparasitic drugs makes it possible to avoid severe complications of these commonly occurring infections. Premalignant benign conditions. Some benign processes, such as cervical erosion, colon polyps, and inflammation of the esophagus, tend to malignant transformation. Early diagnosis and efficient therapy of premalignant conditions are able to neutralize the influence of this considerable risk factor of developing oncologic disease. Genetic mutations. Thanks to the efforts of medical geneticists, multiple genetic risk factors of cancer have been discovered. For example, BRCA gene mutation increases the risk of developing ovarian and breast cancers. In some cases, for example, in Lynch syndrome and certain types of familial adenomatous polyposis, the chance of malignant transformation is near 100%. Timely diagnosis of these changes makes it possible to take efficient preventive measures, including preventive surgeries prior to malignization. Exposure to chemical agents. Environmental pollution and exposure to household and industrial chemical cancerogens have led to a substantial increase in the incidence of lung cancer, cancer of upper respiratory airways, skin, blood, bladder, and breast. Harmful effects of asbestos and benzene-containing aromatic compounds are well understood. Strict adherence to safety rules and recommendations for the use of household chemicals will contribute to the reduction of their harmful effects. Environmental exposure. Effects of ultraviolet, solar radiation, and ionizing radiation are well known and extremely dangerous risk factors, significantly increasing the chance of developing such malignancies as melanoma, skin cancer, and blood cancers. High radiation levels caused by excessive radon concentration in building materials may cause lung cancer in people remaining in unventilated premises for long periods of time. Harmful radiation effects may be diminished by observing industrial hygiene and safety standards, as well as by applying sun protection lotions or sunscreens and by reducing exposure to the sun. Poor nutrition. A balanced diet makes it possible to prevent many diseases, including malignancies. Lack of natural antioxidants, which are mainly found in fruits and vegetables, increases the risk of cancer. Fats are nutritional cancerogens, especially if they were repeatedly exposed to thermal agents. Moreover, there is indisputable proof of cancerogenic effects of some coloring substances and preservation agents widely used in the food processing industry. Obesity. A relation has been statistically proven between excess weight and esophagus, colon, breast, uterine and kidney cancers. Physical activity and maintaining a recommended body mass index are highly important from a preventive point of view. Alcohol consumption. Alcohol intake has both local effect, which affects mucous membranes, and systemic effect, which increases the risk of cancer of the mouth, throat, larynx, esophagus, liver, colon, and breast. Smoking. Aside from the harmful effects of tobacco, active and passive smokers are exposed to cancerogenic resins that are found in tobacco products of any type. Quitting smoking will contribute substantially to lowering the risk of lung cancer in both smokers themselves and their close ones. Additionally, smoking has a proven effect on the incidence of cancer of lip and oral cavity, larynx, throat, esophagus, stomach, pancreas, cervix, and bladder. Finally, it is essential to emphasize the importance of leading a generally healthy lifestyle in order to lower the risk of cancer as much as possible. Put a like under this video, subscribe to the channel, click on the bell and share this video with your friends.